let's get right to some good news. Dr. Jeffrey Barrows is with us. He is an amazing guy. He serves as the Senior Vice President of Bioethics and Public Policy for Christian Medical and Dental Associations. He is an obstetrician gynecologist. He is a guy who left, daily practice to work with MEI, which is Medical Educational International for Christian Medical and Dental Association. He was the director there for forever. He founded later Grace Haven, an organization assisting victims of domestic minor sex trafficking in Ohio. He served as the member of the Technical Working Group on Health and Human Trafficking under the Department of Health and Human Services. He's an amazing guy, and he's ethical. And so when his state said, you have to do, I don't care if you're Christian or not, you have to assist people in suicide, he said no. And he and another doctor, I believe it was Dr. Lacey, took them to court. And by their side is somebody else who's going to be on the phone with us. It's Chris Schandevel. He is the Alliance Defending Freedom Senior Counsel. They won the case. You need to hear about it. Doctor and Chris, welcome to the program.
Well, good morning, Glenn. Thank you for having me on. It's great to be with you this morning.
Thank you. So, Doctor, tell me what you would have been, or people like you would have been forced to do had this not been turned over.
Well, I first need to slightly correct you in that
Okay.
New Mexico is not my state. I actually live in Ohio, but I was part of CMDA, and we have many members, including Dr. Lacey, in New Mexico.
Okay.
And if this law had taken place and we had not filed the lawsuit with the help of ADF, our members would have been, first of all, required to tell their patients who they considered as being terminal, maybe having 6 months or less left to live, about the option of assisted suicide. And then, even if they personally disagreed with it, they were required to make an effective referral if that patient did request assisted suicide. So we're very thankful that the lawsuit was successful in encouraging and getting the New Mexico legislature to change the law, and the governor signed it into law. And it's as you said, a very big win for our members there in New Mexico.
I have to tell you, I don't understand why doctors can't have their own belief and say, no, you know what, I can't do that. I'm really sorry. But if you want to do that, you'll have to go to another doctor, and you can find them. They're out there. Why you're required to, name another doctor that they can go to when you so strongly, religiously believe that it is wrong. And if I'm not mistaken, and forgive me if I am, but I understand that you have a terminal illness that you've been battling. Is that true?
Yes.
Yeah.
Yes. A little over a year ago, I was given the diagnosis of stage 4 non-Hodgkin's lymphoma. And I have made the point that if I lived in New Mexico, my doctor would have been required to tell me about assisted suicide at the same time of giving me that same diagnosis. And I can tell you, being in the patient's position, that would have been devastating to me. I mean, it's hard enough to hear the diagnosis of stage 4 cancer. And you're wondering, all kinds of things are going through your mind. How long am I going to live? Am I going to be able to beat this? And then to have the doctor go on and say, by the way, here is an option for you. You can go ahead and we'll help you kill yourself. That is totally the wrong thing to tell a patient at that time, much less make a physician or healthcare professional say that to a patient.
So it's not just, though, about the medical profession is becoming, to me, extraordinarily frightening because I'm a student of history. I look back at what we're repeating, and through eugenics and all of the things that happened here in America and in Germany, once you start to devalue life, once you start to say, hey, maybe we can kill the young and the elderly because they don't have a life worth living, it goes awry quickly. And so it is not just about that one patient that you don't have to help kill, but it is also, I hope, drawing a line in the sand that says physicians first do no harm.
Exactly. You're exactly right, Glenn, because we have lost the overall purpose of medicine, which for millennia has been to heal the patient, not to kill the patient, but to heal the patient. And if they suffer from a terminal disease, to help them as much as possible, to limit the suffering, to come alongside them, to support them, but never, ever should we be hastening that death. And this is exactly where medicine is going, unfortunately, across many areas of the country. So we're very thankful again for the help of ADF and for the New Mexico legislature listening to this lawsuit and recognizing the importance of looking and accepting the conscientious rights of healthcare professionals.
Chris Schandevel is senior counsel for ADF. That's Alliance Defending Freedom. You are fighting a battle just like this now in California, aren't you?
We are, Glenn. Thanks so much for having me on. So what we saw in New Mexico is actually it's very unique. Oftentimes when these laws are passed legalizing assisted suicide, what we've seen in state after state is that the so-called safeguards that are supposed to be put in place, and even protections for conscience beliefs. Number one, they don't last and they don't work. And so California is a really good example of that. So that when they first passed their law, they did put in so-called protections for medical professionals like Dr. Barrows, but it wasn't too long after that they amended their law to take away those protections, thus prompting our lawsuit. So we're really thrilled and excited by what we saw happen in New Mexico. Probably one of the first, maybe the first times that we've seen a law like this get amended in a positive direction. So we're really hopeful that not only are we going to start stemming the tide of this wave of legislation across the country, but that we might even be able to start turning that tide as people learn more about what's actually at stake with these laws.
Doesn't this also kind of bleed over into the push now to have all doctors, no matter what their religious belief, they've got to participate in some way or another in abortions?
Absolutely. I think it's a part of this broader push to really weaponize the medical profession to advance a radical political agenda, whether that's with end-of-life issues, as we're discussing today, whether that's at the beginning of life with forced participation in abortion, whether that's with sex change surgeries and all of the procedures that go along with that doctors are being now told that they have to participate in as the price of practicing medicine. And what Dr. Barrows and the other doctors that we represent are standing up and saying is that, the medical profession is supposed to be about helping and healing people. It's not supposed to be about hurting and killing people as this radical agenda proposes. And again, we're just thrilled that we're already starting to see victories on the ground like we saw in New Mexico. And we're very optimistic that as more people learn that these laws are going to drive good, excellent doctors like Dr. Barrows out of the medical profession, that people are going to stand up and say, we're not going to allow that to happen here in America.
So, Dr. Barrows, let me ask you, I'm so concerned of what's happening in Canada because they're just ahead of us, and they're already having physicians assist suicide for depressed teenagers. It's crazy what's going on up there. But it's not just the law that is doing it. There is this push in medicine, especially at the school level. Our universities that are teaching our next doctors are discriminating on, gender care. If you disagree with any of this woke stuff, you're going to have a harder time getting in. So we're spoiling the next group of doctors that are going to replace you. Is there any battle, real significant battle and pushback to this stuff in education?
Well, Glenn, you're again hitting a very important point. Not only has Canada crossed into the provision of assisted suicide to younger people, but they've also crossed the threshold into euthanasia, which is what we want to avoid here in the United States at all costs. But especially in regards to what you were talking about with Chris and training in OBGYN or for medical students, it's one thing for a practicing physician who has established themselves and they've got a practice to be able to refuse to engage in either assisted suicide or an abortion. It's quite another when you are a senior medical student or a first-year resident in obstetrics and gynecology, where you're being put in a position where you're told you have to assist in an abortion. And what student has the ability to understand my whole education could be threatened if I refuse? And this is what we're seeing happening more and more across the country in all kinds of medical education scenarios. And frankly, we're quite worried for our students and residents and trying to look for ways to be able to protect them.
Yeah. Anything we can do to help you, let us know. Dr. Barrows, thank you for everything you've done, and thanks for helping stand up, and congratulations, and thanks to Dr. Lacey as well. And if you would like to help in this fight, adflegal.org. They could always use donations. adflegal.org. Find the thing that you're passionate about and go in deep. Help them stand against this real evil that is going to last a generation already. If we don't stop it, it's just dark stuff ahead. adflegal.org.